Hi, I'm Dr. Michelle Kurlansky with Lighthouse Foot and Ankle, talking to you today about metatarsalgia, that pain you have in the ball of your foot. Sometimes you have a callus with it, and I just wanted to talk today about some treatment options that we have at the office. Here you can see a typical patient with metatarsalgia. Metatarsalgia actually means pain in the ball of the foot. It's a very, very general term. A lot of times it's associated with a painful callus on the bottom of the foot. You don't have to have a callus to have metatarsalgia, but the two often go hand in hand. Most people who have metatarsalgia will have pain barefoot. So walking around the house barefoot on hardwood floors or on thin carpeting will often have pain. So we have several conservative treatments for metatarsalgia. So I really like these Cloudwalker inserts. They have a nice polyurethane material, very cushy. They're very long lasting. We also here, if you come to the office, I debride the callus, which is a very fancy way of saying trimming the callus. And we also recommend and dispense moisturizer. So I have this really great product here called Camilla G, which works really well for a very focal callus. Also, sometimes we dispense some padding, like a dancer pad, something to offload the area. So those are some really good conservative treatment options that we have. So let's say you've tried the conservative measures, you've tried the inserts, you've had the callus trimmed, which you can see in the image, you've had padding, you've tried wider shoes, you've done all the right stuff, but you're still having pain. So we have a newer therapy called Leneva, which is an injectable fat that we inject into the area to add cushion. When you have fat pad loss, you can have a bony prominence, and now we can add fat to act as cushion. It can also work on patients who have had fat pad atrophy in the heel. So basically, we're adding cushion. Instead of just walking on cushion, we're actually physically adding the cushion to the foot. So here's an image of Leneva in the syringe right before we inject it. It literally looks like fat because it's fat. And we inject it right here in the office. It's also used for diabetic wounds and tunneling wounds, basically anywhere we need to augment or add some padding to the tissue. In this image here, you can see me injecting Leneva to a prominent area of the big toe. The area was numbed prior with local anesthetic and then prepped with betadine. I'm injecting the Leneva right under the skin, right above the bony prominence to act as a cushion. The whole procedure takes maybe 5 minutes total. Here you can see the area immediately after the injection. It's a little prominent, a little puffed up. The patient's going to have a nice bandage on afterwards and wear a post-op shoe for 1 to 2 weeks. The patient can go home and shower. If it's on the bottom of the foot, the patient can't shower immediately. We'll have to wait a couple days because we use a nice pad to offload the area. So after the injection, we tell our patients to avoid high-impact activities for 3 to 4 weeks. So jumping jacks, anything that's going to put excessive weight on the foot. And it may take up to 8 weeks for the graft to fully incorporate into the tissue. And the injection may not last forever, but usually people get about 1 to 2 years out of the injection. So if you're interested in Leneva or finding out more about metatarsalgia and the treatment options that we have, please visit our website, lighthousefootlandankle.com, or give us a call directly at 207-774-0028. Thank you.